The head of social impact and senior lecturer on business in society at the University of Stellenbosch Business School, Dr. Armand Bam, has lamented the closure of several old-age homes on the Cape Flats recently. The Cape Peninsula Organisation for the Aged, a non-profit organisation in Cape Town, decided to close down the homes 2 months ago, citing financial constraints brought on by the COVID-19 lockdown. It said at the time that despite subsidies from the Department of Social Development, it had accumulated losses amounting to 265 million rand in the past 10 years. Dr. Bam is among the experts who've raised concerns about these closures and argues that these institutions should be sustained. Well, he joins us now via Zoom. Dr. Bam, thanks very much indeed for joining us. Welcome to the programme. Accumulated losses of 265 million. I mean, you are at a business school. The maths doesn't add up.
Yeah, I think, good evening, Peter. The one side is that we get to see what the losses are. And I think that is something that should concern all of us in society in terms of what it actually costs to have welfare organizations run. The other side, obviously, is for an organization like the CPOA, it has a business side, and we haven't quite got to grips with that side of its business. So there's a balancing act which I don't think has actually happened in this situation, where it is that as the losses are being made, and the downside to that is that the poorer community suffer, there are also the upsides in another aspect of its business, which we probably need to understand better.
All right, just give us an overview of what the CPOA do and how important their role is in terms of the elderly.
Well, when we look at the particular side that we've had some experience with, is the welfare homes in the communities of Bonteheuwel, Hedeveld, and Bishop Lavis. And essentially what they provide is care for the elderly. That's the one side, and that's what they consider to be the welfare work that they do. On the other side of their business, they do sell retirement homes, and when you look at who can afford those, it tends to be privileged people who have been economically active and have benefited from the legacy of apartheid. So we have this imbalance that's happening within an organization.
So how do we go about fixing it? Because clearly those that are underprivileged and perhaps most vulnerable are the ones that need the help the most, and they're the ones that are seeing their homes closing.
Yes, most definitely. And that's where, when we look at the impact of the pandemic, at about a year ago, I cautioned and expressed my concerns around who was going to be affected the most. And the CPO is only one of many organizations where you're going to be seeing the shutting down of services and critical services, particularly in the communities that need it most. And to some degree, I don't blame them, because it would make business sense and to stick your resources in where it is most profitable. But there is the moral questioning that has to go along with this. Is it good practice to shut down the services in the communities that need it most?
You know, some people might say then, look, do they not have families perhaps who can take care of them? Where do they go?
Well, if you have driven around in Bonteheuwel, Hedeveld, most of the Cape Flats, it's clear that people have families, but if you look at the circumstances that they are living in, the access to resources, it generally isn't possible for homes where people are unemployed to take care of the elderly. And this is the big issue. You've got to look at the circumstances of the entire community. These are under-resourced communities. These are not affluent communities. These are the communities where the unemployment rates exceed what we see in South Africa as a whole. These are communities that are plagued with social ills. So it's not as simple as saying that they have families. Granted, people have families, but can they afford to sustain themselves and those who need this critical service? I mean, being frail in South Africa is not as easy as what it is in other parts of the world. In Europe and in the Americas, the medical systems are far more amenable to taking in people and to caring for them. Yeah, I don't think we have such a well-coordinated system.
Does this mean that perhaps our social development, healthcare systems have to be re-looked, perhaps, and look at this layer of society, the aged, and provide budgets all over the country to make sure that the aged are taken care of in facilities?
Yeah, I think we're living in an imbalanced society. We have government and the public sector doing what it does, the private sector that's trying to ensure that it stays afloat, and all the meanwhile, the social sector is suffering due to this pandemic. And it's not just the pandemic. When we look at what the finance minister announced just recently, an increase in the social grant of 30 Rand. If we have 10 people living in an old age home, that is a total of 300 Rand that is going to come towards that home. It is impossible to have people living with dignity when it is that we cannot prioritize what it is that we are spending our money on. We have labor unions who are now asking for increases, and there's just this sense of we are not looking at what the bigger picture is. Those who are in power need to stop and think about those who are most affected, the weakest of us. And I say weakest in terms of the inability to access resources in the way that many of us can do because of the fact that we have access to education, we have access to employment. There's something that we are missing. And I think it requires a rethinking. As this welfare gap increases, the burden is going to fall on government and the private sector. And so in reality, it is their problem. And they cannot avoid it. The longer we leave this particular issue of resourcing the social sector, the greater the need is going to become.
All right, and we've been talking about how COVID-19 has impacted the facilities and the services. And we've known that elderly people were particularly vulnerable and still are particularly vulnerable to the virus itself. Have you seen that in these homes, and also as a result of these homes closing down, that actually infections became another multiplier?
Yes, I've been in contact with a number of leaders in organizations, and their first instinct was to shut down the movement of people within their homes because they feared for the worst. And in doing so, it's limited people's movement. It's also limited their ability to seek funds. So there was almost an immediate impact in terms of securing the health and the well-being of the aged. I'm still actively involved with a nonprofit organization where we take care of vulnerable blind people. And not too long ago, the grants were cut for those organizations. So you've got social development that's cutting grants. You've got money that's disappeared from the fiscus. You've got a pandemic that's come into the equation. And now you've got everybody looking to see how it is that they can survive. And I think we need to pause as a country. Everybody at all levels, in all spheres of society, actually needs to take stock and take hold of what it is that they're doing on a daily basis, how it is that their actions impact those most at risk. And there are many government officials that like to point the finger at each other, but there are gaps and there are problems that we can see that have been exposed and that are being exposed due to those leaders within the public sector that's still being dealt with. But the impact is a real impact. Lives will be lost. People will be put out of their homes. they'll have to be relocated and taken from their communities. And that for me is disheartening, when it is that we remove the elderly from their communities.